Hi, sir. My name is Travis. I'm going to be your nurse practitioner today. Do you care if we go ahead and do a full head-to-toe assessment?
Yes.
Okay, I'm going to start with your head. I'm going to look for size. It's normal. Symmetry is normal, and it is midline. We are then going to move to the top of his head. We're going to look. Our hair is normal distribution, color, and texture. It is coarse, brown. We're then going to palpate. We are feeling for any tenderness. Do you feel any? Let me know. Our skin is warm and dry. We do not see any lesions, masses noted. No bruising, scarring. We do have multiple nevi throughout. Our hair is thinning a little bit on the top. I'm then going to move to your temporal artery. Is that tender?
No.
It is a +2. I'm going to move to the preauricular lymph nodes. I'm going to feel my way around the postauricular to the occipital, down the posterior cervical chain. I'm using the pads of my fingers in a small circular motion. I'm going to move up the anterior cervical to the tonsillar, the submandibular, and the submental. I don't feel any. If I can get you to flex your shoulders inward, bring them in. There you go. And the supraclavicular, I also do not feel any there. I'm now going to have you bite down for me. All right, the masseter muscle is strong on both sides evenly. I'm going to touch you real quick. Can you tell me, does that feel the same on both sides?
Yes.
Can you feel it?
Yes.
Okay. About here?
Yes.
Here?
Yes.
And here.
Yes.
Any abnormality in sides? Okay. I'm then going to, that was cranial nerve 5. I'm now going to test cranial nerve 7. I want you to smile, frown, purse your lips, pucker them. All right, there you go. Raise your eyebrows, and let's see, puff your cheeks out. Okay. Cranial nerve 7 is intact. We're now going to move on to the ears. They are good in size and position. They want to feel around the pinna and the tragus. Is that tender? No nodules or masses were felt. I'm going to take a look in your ears real quick. The external canal has a little bit of wax in it, but no discoloration or lesions noted. I'm going to pull down and back since he is an adult to look at that tympanic membrane. It is pearly gray. There is no signs of rupture, no fluid, and it is intact, pearly gray. Same thing on this side. The external canal has some wax in it. The membrane is pearly gray. It does not appear to be ruptured. There's no fluid, edema, or erythema noted. I'm going to do a whisper test. Whisper in your ear, tell me what I say. 2, 2, 4. And that patient whispered back to me correctly. The whisper test was negative for hearing loss. You will tell me if one ear or the other sounds louder. The Weber test does not lateralize. It is negative. I'm going to stick this behind your ear here on the mastoid bone. Whenever you stop hearing this, you let me know.
Now.
You hear that?
Yes.
All right. And same thing on this side. Tell me when you stop hearing it.
Now.
And
yes.
All right. Air conduction is greater than bone conduction bilaterally. Patient does not have any hearing loss with the whisper test, Renee or Weber, which covers cranial nerve 8 being intact. Now I'm going to move on to your nose. It is straight and midline. I'm going to have you tip your head back for me. I'm going to take a look in here. The turbinates are intact. I see the distal and medial turbinates. It looks like we have a lesion on the medial turbinate of the left side. Mucous membrane is pink and moist. Septum is midline, and I think that about covers. Oh, go ahead and take a deep breath in for me. Okay. Deep breath in. Were you able to get air on both sides? Nose is patent in both narratives. Now I'm going to take a look at your mouth. Go ahead and open it up. All right. Dentation looks normal. No cavities or fillings are seen. The palate is pink and moist. Tongue is pink and moist. No signs of Candida. Lift it up for me. The bottom is pink and moist with blood vessels appropriately. The salivatory glands do not have any stones. They're not erythematous or edematous, and there is no abnormal drainage noted. Go ahead and stick your tongue out. All right, say ah. All right, cranial nerve 9, 10, and 12 are intact. The uvula rose up with the soft palate for 9 and 10, and the tongue came out for 12. Midline, go ahead and stick it out for me again. Just go, sticking your tongue out. Midline with no vesiculation. All right. We are then going to, the posterior pharynx was pink and moist, as well as the tonsils. There was no erythema or edema noted, and there are no white patches indicating viral or bacterial pathology. We're now going to move on to your eyes. The eyebrows and eyelashes have normal hair distribution. It is brown, symmetrical, and coarse. I'm going to look at the palpable fissures. Our skin assessment is negative for edema, bruising, scarring, lesions, and nevi. There is no infestation on the head, eyebrows, or eyelashes. I'm going to have you follow my finger. We're going to check cranial nerves 3, 4, and 6. Cranial nerves 3, 4, and 6 are intact. Go ahead and follow my finger all the way in. All right, accommodation and conversion were good. So cranial nerve 3 is intact there. And we're going to shine a light in your eye. Pupils are equal, round, and reactive to light. When I shine into his left eye, the right pupil also constricts. I'm going to have you do a eye chart for cranial nerve 2. If you would hold this out about 14 inches there. Tell me what the furthest one down you can see is.
Second from the bottom. 9, 3, 7, 8, 2, 6.
Okay. Both eyes. Patient is 20, 25. Go ahead and cover your right eye.
Third from the bottom. 3, 7, 4, 2, 5, 8.
Okay. Patient is 20, 30 in the left eye. Go ahead and cover your left eye.
Also the third from the bottom. 3, 7, 4, 2, 5, 8.
Patient is 20, 30 in the right eye. Let's see. I'm also going to do a confrontation test for you. I'm going to get real close here. Tell me when you see my fingers wiggling.
See them.
How many fingers?
2. See them. 1. See them. 2. See them. 2.
Correct. All right. Confrontation is intact. That was testing cranial nerve 2, which is intact. I'm now going to check his red reflex and vessels in his eye. All right. If you would stare ahead, pick a spot there on the wall, okay? Red reflex was intact. I see vessels, a macula, and a cup and disc. The cup is half the size of the disc. No cherry angiomas. No signs of macular degeneration or diabetic retinopathy. I'm going to take a look at your left eye here. Red reflex is intact. Vessels are intact. Macula and cup and disc are intact. no abnormalities noted in the left eye as well. Sir, if I could, I'm going to feel your neck here. I'm feeling for your trachea. The skin is warm and dry. Nevi are noted, no scars, lesions. It's not tender when I touch you, is it?
No.
No tenderness, no masses noted. All right, I'm going to feel your pulses. Carotid. There's a +2 bilaterally. I'm going to have you shrug your shoulders. All right. Go ahead. Cranial nerve 11 is intact. Go ahead and bring your chin to your chest all the way back. Go ahead and laterally flex to the left. Lateral flexion to the right. Lateral flexion. Looks like his neck's a little tight on those. Go ahead and turn your head left and right all the way, trying to touch your chin to your shoulder. Looks like rotation is also a little tight. All right, we're going to move on to the back of your chest. If I could get you to twist this way. We're going to assess his skin. We'll see multiple nevi present, no scars, lesions, masses noted. I'm going to palpate for the masses. I don't feel any. He doesn't have any signs of respiratory distress, such as nasal flaring, cyanosis, no retractions or accessory muscle use. He does not have any tripoding. I'm going to do tactile primitus. You say 99?
99, 99, 99, 99, 99.
No consolidation was felt through increased vibration. I'm going to percuss, starting at the upper lung borders, moving down left to right around the scapula. He is resonant all the way around so far. He's resonant, including the mid-axillary line on the right side, covering that right mid-lobe. Now that I have done tactile primitus and percussed, I'm going to have you take a deep breath. He has normal symmetrical expansion of the chest. No obvious deformities have been noted. I'm going to take a listen to you. Take a deep breath. Same thing here, working down around the edge of the scapula between the intercostal muscles. Working left or right. Mid-axillary on the right side to catch that right middle lobe. He is clear in all lobes. No rhonchi, wheezing, or crackles noted. I'm going to have you say 90, 99?
99,
99?
99,
99?
99,
99?
99,
99?
99,
99?
99,
99?
99,
99?
99,
99?
99.
Bronchophony is negative. 99 sounds muffled. It does not sound like 99. I'm going to have you say E.
E,
E.
E,
E. E.
E,
E.
E,
E.
E,
E.
E,
E.
E,
E.
E.
Egophony is negative. E sounds like E. It does not sound like A. Go ahead and whisper 99.
99,
Whisper peculiarity is negative. 99 does not sound like 99. It just sounds muffled when I hear him speak. All right, sir, if I can get you turned back this way, I'll take a look at the front of your chest, looking at your skin. It is warm and dry. no obvious deformities. We do see nevi present, no masses, no edema. Turgor is good. It does not tint. We don't see any bruising, lesions. I'm going to have you say 99.
99, 99, 99, 99.
Take a deep breath. The expansion is normal. All right. Tactile fremitus was negative. There was no consolidation through increased vibration. Percussion showed resonance throughout. No abnormalities noted. Now I'm going to take a listen to you. Deep breath. Catching the apex of the lungs above the supraclavicular there. Gonna go work my way down between the intercostals, moving left to right. Make sure I hit that mid-axillary line to catch the right mid lobe of the lung. He is clear all over, no wheezes, rhonchi, crackles, or rails noted. Sir, if I could, I'm going to listen to your heart. I'm going to start at the second intercostal on the right side at the aortic valve. Move over to the pulmonary valve. Erb's point, tricuspid, and mitral. S1 and S2 are heard at all sites. No murmurs or bruits noted. I'm now going to listen with the bell of my cystoscope. Same thing. Second intercostal space over the aorta, pulmonary valve, Erb's point, tricuspid, and mitral. S1, S2 are heard. No murmurs or bruits noted at any of those sites. All right, if I can get you to hang out there, I'm going to palpate for the maximal impulse. And I'm going to listen to you for a full minute there. He is 66 and regular. Sir, I'm going to come back up to your jaw. I forgot to check you for TMJ. Go ahead and open. All right, I do feel some subluxation there. Is that tender?
No.
No, okay. And there was no crepitus noted, just a subluxation. If I can get you to lay down here for me, I'm going to look at your chest for lifts and heaves. I'm going to palpate over the second intercostal space, over the aortic valve. We'll move over to the second intercostal on the left to the pulmonic. We'll move down to Erb's point, the tricuspid, and the mitral valve. I do not feel any thrills. I do not see any heaves or lifts in the chest. I'm then going to take a listen to you with you laying down. Over the second intercostal space, over the aorta. Second intercostal space on the left, over the pulmonary, Erb's point, tricuspid, and mitral. I'm going to do the same thing with my bell. S1 and S2 are heard over all sites. There was no murmur or bruise noted in any of the sites. I'm now going to take a look at his abdomen. I'm sorry, I'm going to have you sit up about 30 degrees. I'm going to hold you here. Just tip your head back for me. There you go. There is pulsation noted over the IJ. However, it is non-distended. There is no, go ahead and relax. There's no we'll move on to the abdomen here. I'm going to take a listen or look at him. He is flat and symmetrical. I'm going to take a listen to the aorta, the renal arteries, the iliac, and femoral, no bruise were noted over those 5 sites. Skin is warm, soft, multiple nevi present, no lesions, masses that we can see, no bruising or scarring. I'm going to listen to the abdomen in all 4 quadrants. Tympany, 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 and tympany. And earlier, when we set him up, we saw no JVD. There was no distension of the IJ. I'm now going to palpate percuss all 4 quadrants. There's tympany noted in all 4 quadrants, no flatness or dullness that would indicate fluid or tissue. I'm going to lightly palpate your abdomen. Does that feel okay?
Mm-hmm.
Let me know if it's tender. Any tenderness anywhere? No. Okay, I'm going to do a deep palpation. Moving down to 5 to 8 centimeters. Is that tender? No masses were noted with light or deep palpation. I'm going to palpate your liver real quick. I'm going to put my hand up under your costovertebral angle there. I'm going to push down and up, and you take a deep breath. The liver was not palpated. Same thing over on this side. We'll find that costal. All right, go ahead and take a deep breath. Spleen was not palpated. Percussion of child space was negative. It was resonant and not flat. There is no splenomegaly. I'm going to percuss over tympany till I hear there's the lower margin of the liver. I'm going to come over resonance. All right. So he is about 6 centimeters, which is within normal limits. I'm now going to have you sit up, and I'm going to tap on your back here. Find the costovertebral angle. Was that tender at all?
No.
Okay, I'm going to have you turn out here for me. All right, really quickly, I'm going to do your reflexes. If you will just let me have that wrist there. All right, that one is a +2. Come up to your bicep here. Just relax that for me. Just relax. Okay, bicep was a 2. Tricep was a 2. 2. Reiki. It's 2. Bicep. Here, let me have that. Just let me have it. You got it. Oh, there you go. All right, that was a 2. And tricep was a 2. I'm gonna move down to your patellar. Same thing. I'm gonna put my hand under it and just let it hang. Okay. All right. Just let it hang there. Patellar was a 2. Just let it hang. Give it to me. It's okay. Just let it relax. Okay. Just let it relax over my hand. There you go. All right. That one was a 2. I'm going down to the Achilles. It's 2. Achilles was a 2 bilaterally. Babinski was good. All right, now I'm going to take a look at your fingers. They are symmetrical, no redness, swelling, or nodules. No crepitus is noted. Is any of that tender? No. Okay. Capillary refill is less than 2 in both extremities. Go ahead and bend them for me. Put them out. Flex them up. Flex them out. And back in. Extension, hyperextension, flexion. I'm sorry, flexion, extension, hyperextension, adduction and abduction. Abduction and adduction are good. Same thing with, check your wrist out here. Check your wrist out here. I don't feel any crepitus. There's no redness or swelling. No nodules noted. Does that hurt?
No.
Okay. All right. I want you to pull them in toward your thumb. Out toward your, all right. Down. Up. All the way back. And rotate. All right. Range of motion is within normal limits. I'm going to have you, I'm going to feel this elbow here. Feel this elbow here. There's no crepitus noted in either. Do you feel that?
Yes.
What about that?
Yes.
No, I'm sorry. I'm supposed to do it on this side. How about that?
Yes.
Yeah.
Yes.
Vibration on the ulnar aspect is felt. Do you feel this light touch on your fingers?
Yes.
Sensation is intact distally. Go ahead and turn your hand over like that and move faster. Other side. All right. Go ahead and touch your thumbs to all fingers. All right. Bring your thumbs in. Thumb all position is good. All right. Go ahead and touch your nose. Touch my finger. Touch your nose. Touch my finger. Other side. All right. Occipital is intact. I'm going to feel your shoulder here. There's a little crepitus noted in the right shoulder. No crepitus in the left. Skin is normal with nevi on it. Warm. No bruising, lesions, scars, or drainage noted. It is non-edematous. Turgor is good with no tinting. I'm going to now have you squeeze my hands. Squeeze, 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 squeeze. Hard. Perfect. All right, I want you to pull me toward you. All right, push me away. All right, and I want you to put your arms like this. I want you to open up. All right, and pull them together. Strength is a 5 in the hands, biceps, triceps, and shoulders. I'm now going to move down to your lower extremities. I'm going to be feeling on your toes here to let me know if that's tender. They are bilaterally symmetrical. There is no nodules, redness, swelling, deformities. It wasn't tender, was it?
No.
Okay. I'm going to check your capillary refill. It is less than 2 bilaterally. I'm going to check your DP pulses, your +2, your PT pulses, which are +2. I'm going to have you flex your toes down, extend them up, bring them back all the way you can. Extension and hyperextension are good. Flexion was also good. Go ahead and spread them apart. Adduction is good. Bring them together. Abduction is within normal limits. Okay, go ahead and let me move your ankle around here. I don't feel any crepitus. It's not warm. There's no swelling or deformities noted. No crepitus noted. Well, there's a little bit of crepitus in this right ankle. Go ahead and bring your toes to your nose. Okay, bring them down. Or flex your ankles down. All right, flex them up. Flex them out. Flex them in. And rotate them around. All right. Flexion, extension, hyperextension, adduction, abduction, inversion, eversion, and rotation were all within normal limits on the lower extremities. Do you feel me touching you down here?
Yes.
All right, and sensation is intact distally. I'm going to put this on your medial ankle. You feel that?
Yes.
You feel that?
Yes.
Vibration is intact at the medial ankle. All right, go ahead and lay back up here for me. I want to test your strength of your ankle. I want you to press the gas pedals. That's 5. 5. Yeah, pull up toward you again. 5. All right. I want you to pull your knee up to your chest and push it down and extend it all the way out. All right. Same thing on this side. Flexion. All right, come on down. Extension and hyperextension are good. All right, go ahead and pull me toward you. All right, push me away. Knee is a 5 on the right. Pull me toward you. All right, push me away. 5 on the left. Go ahead and pull your heel up to the bed here. All right, push me away this way. All right, pull me toward you. Hip strength is a 5 on the right and a 5 on the left. Go ahead and put those down. If I can get you to go ahead and stand up for me. All right, so I'm gonna have you turn this way. Oh, I'm sorry, back where you were. That's good. I'm gonna feel your hip here. Is that tender? No? Okay. Bring that right knee up for me. No crepitus is noted. Go ahead and put it down. I'm gonna come over here to this left one. Is that tender? Palpation appears normal. Go ahead and lift that leg up. All right, down. All right, good job. Was that tender at all?
No.
There was no crepitus noted. No obvious deformities. Skin is intact. There is no edema noted. Turgor is intact. We do have nevi. Hair distribution is normal. There is a tan line where the patient wears socks. All right. If I can get you to, now I'll keep you balanced here, but bring your hip up. Bring it out toward me. In. All right. Bring it down. Just take a step forward for me. All right. Bring it back as far as you can. All right. Bring it forward. All right. And rotate it inward and outward. Okay. Same thing with the other side. Here, yeah. Raise your knee up, bring it out. Or, no, keep that knee up. Out. Knee out. Knee in. Alright, bring it down. Turn this way. And go ahead and bring it back as far as you can. Alright, forward as far as you can. Alright, good job. Alright. Flexion, extension, hyperextension, abduction, and adduction are good. Can I get you to rotate in on both sides? Rotate in and out. Alright, same thing on that side. Internal and external rotation are normal as well. I'm going to have you turn this way for me and bend over. Is that tender anywhere?
No.
Okay. No tenderness noted. Spine is midline. There is no abnormal curvature left or right. He does not have scoliosis. If I can get you to stand up. His cervical is lordoticed. His thoracic is kyphosed. Lumbar is lordoticed. And sacral is kyphosed. That is within normal limits. Go ahead and extend back for me. All the way. Extension and hyperextension are within normal limits. Come on back up to midline there. Lean to the left and right. And rotate your trunk for me. Alright, lateral flexion is within normal limits and rotation is within normal limits. I'm going to have you walk with me here. Tandem walking, gait is normal. I'm going to come up behind you. Go ahead and walk that way for me. Come back this way. Gait is within normal limits. I want to be here to hold you. I want you to close your eyes. Alright, open them back up. Romberg test is negative. Go ahead and hop on your right leg. And go ahead and put that down. And hop on your left leg. Alright, thank you, sir.